what's really going on behind those mountains of stuff? Well, today, we're going to unpack the psychology of hoarding disorder. We're going to use our source material to really get to the heart of the powerful beliefs that drive this condition. I mean, have you ever found it hard to let something go? We've all been there, right? You're about to toss out, I don't know, an old concert ticket, a stack of magazines, and you just pause. You hesitate. You think, maybe I'll need this someday. It's a totally normal, very human feeling. But what happens when that little moment of hesitation isn't so little anymore? What if it grows from just a small feeling into this powerful, commanding force? See, for someone with hoarding disorder, that need to hold on isn't just an occasional thing. It's constant. It's overwhelming. It's a part of their everyday life. Okay, so this brings us to the actual clinical definition. What is hoarding disorder, really? Well, it's defined as the excessive accumulation of items, and it doesn't matter what their value is or even if they're useful. The two big things to remember here are, one, the sheer amount of stuff, and two, the fact that it's all driven by what our source calls a powerful feeling of need to save the items. That part is absolutely key. So that definition tells us what it is. But what does this actually look like in practice? How does all of that accumulation even happen? Well, it's not just one thing. It's actually a cycle, and it all comes down to two key behaviors that work together. And here they are. It's pretty straightforward when you break it down. First, you've got excessive acquiring. That's a really strong tendency to get new things, to bring more stuff into the space. But then, on the flip side, you have difficulty discarding. This is a deep, persistent struggle to get rid of anything. So you can see what happens, right? When you're constantly bringing things in and you can't let anything go out, well, the result is this huge, overwhelming accumulation. Okay, so we get the behaviors now, right? Acquiring too much, discarding too little. It makes sense. But what's driving all of this? What's the engine behind these actions? What's really at the root of this powerful cycle? And this is where we get to a really fundamental shift in how we understand this disorder. Because it's not about the items themselves, the piles of stuff. That's just the symptom. It's what you see on the surface. It's not about being messy, and it's not about a lack of organization. Our source material tells us that the real driver is something much, much deeper. It's a core belief system. In this quote from our source, man, it just gets right to the heart of it. It really says it all. It's this deeply held belief that the saved items are unique and will be needed in some point of time. That's the core of the whole thing right there. So let's break down that mindset of saving. It starts with this overwhelming feeling, this need to save the items. It's less of a choice and more of a compulsion. Then that feeling gets backed up by a belief that every single item is unique and special. And finally, it all leads to this complete certainty that these things will be needed in the future. So throwing them away, that would feel like a huge, terrible mistake. So let's put all the pieces together and see how this cycle works. Step one, it all starts with that powerful belief we just talked about, that these items are unique and absolutely essential for the future. Step two, that belief directly causes those two key actions, acquiring way too much stuff and having incredible difficulty getting rid of it. And, well, step three is the inevitable result, the massive accumulation of items. It's a perfect feedback loop. And this is really the most crucial point to take away from all of this. Hoarding disorder isn't random and it's not lazy. It operates on its own powerful and consistent internal logic. And that's why it's so important to see it as a complex psychological condition, not just a personal failing or a lack of organization. That's absolutely essential for understanding what's really going on. So I want to leave you with this final thought. All of us have possessions that hold some kind of meaning, but learning about this condition really makes you think about a deeper question, doesn't it? Where exactly is the line between a cherished collection and a compelling, overwhelming need? It's definitely something to think about. Thanks so much for joining me for this explainer.